Hello, welcome to our Vaccine Q&A. My name is Auden. I am a Barnard Health Ambassador. I am a junior at Barnard, and I am here to get some vaccine questions answered with
Me, Dr. Marjorie Seidenfeld. I'm the medical director of the health service here at Barnard. I've been here for 16 years. And I was going to be joined by MJ Murphy, our executive director, but she was unable to make it and she apologizes for that. So sorry about that.
No worries. Thank you so much for making time to be with us. This is very helpful. I think, especially with the recent rollouts of vaccines, I at least personally have a lot of questions. So I think that this will be a more straightforward way to get some of them answered than doing Googling and not being sure if the information I'm getting is correct or who it's coming from. So, okay, I'm just going to jump right into the questions if that is okay. So the first one I have is about Barnard specifically, and Barnard's plan. I know that there is the sort of Alert Barnard webpage has a vaccine implementation tab, but there doesn't actually seem to be any information about Barnard's implementation plan. I don't know if that's clearly developed yet, or even if it is, if you have the capabilities to share that, and I totally understand if you don't, but yeah, to whatever extent you're able to share what Barnard's, even if they don't have a plan, what their sort of hopes and dreams are for vaccine implementation going forward into the next year.
So our plan is going to be very dependent on the New York City Department of Health. We have to wait until, there's sort of a line, we have to stand in line and wait until we are able to obtain the vaccine. So, the rollout has been less than smooth, as you all know. So we have to wait until we're able to obtain it. And that will depend on the Department of Health. Right now, it's only city and state who are in charge of it, who have it, who own it, who are able to dispense it. And it's through those outlets that we're able to access it. Eventually it'll be the other outlets such, CVS, Duane Reade, those kind of locations. And eventually we'll be able to get it, but it'll be very dependent on the Department of Health. So we have to wait and see. In the meantime, we are planning to have it here. We are ordering equipment to be able to store it here, and we are, preparing, and we're going to be ready for when we have access to it, but it'll be dependent on when that's available. So that's why we don't have a specific plan, because we have to wait until we are,
Right.
we're able to access it.
I've heard a couple, I'm assuming these are rumors, but just want to confirm that Colombia has purchased a certain numbers of vaccines. It sounds like, based on what you said, that wouldn't be possible.
I don't think that that's true, but I don't know.
Okay, thank you. Okay, let's see what else we have here. Will the vaccine availability, and maybe this again is not 100% yet, but will the accessibility differ between students, faculty, and staff, or would it be likely that the rollout would be the same for all members of the Barnard community?
So here at Barnard, we dispense vaccine to students. We, particularly at the health service, we give vaccines to students. Staff and faculty access it through their own healthcare providers in general. Sometimes human resources makes certain vaccines available through HR, but that remains to be seen if this will be included in that.
Okay, cool. So my next questions are more specific to the vaccine itself. I know that there are some minor differences between the Pfizer and Moderna vaccines and the Johnson & Johnson one that seems to be coming out soon, likely. I also know that there are different waiting periods between the first and second doses for Pfizer and Moderna. So I have some questions about what exactly the differences are between those three and why the periods between the first and second dose are different.
So the Pfizer and Moderna are the most similar. They're mRNA vaccines. And so I guess we should back up and say that all the vaccines are targeting the same thing. The point of the vaccine is to elicit an immune response that toward the spike protein on the virus. So it gets your body to recognize that spike protein so that if the spike protein, which is on the surface of the coronavirus, enters your system, you will mount an immune response to that spike protein and destroy the virus. That's the goal. And so how do you get the spike protein into, or something that looks like the spike protein into your system so that you can mount this immune response? So different companies have gone about this a different way. So Moderna and Pfizer have the mRNA vaccine. So the mRNA will produce it's a way to get the mRNA into the cell to have it produce that spike protein, and you have the spike protein circulating and it causes that immune response. And
that's why you kind of get a little sick sometimes when you have it.
It's that immune response that you're having is what makes you feel a little bit sick. Yes. Okay. And that's actually a good thing. So if you're feeling sick, it feels crummy, but that's actually a good thing because your body is working, like it's making that immune response. So it's actually a really good thing. So you can kind of rejoice in that fever and muscle ache, because that means things are good. So the difference between the two is just the difference is between the different vaccines is just the way it's getting your body to make that spike protein. So the mRNAs are being packaged in little lipid packages, and that's how that gets into your system. The Johnson & Johnson puts a DNA that produces the spike protein into an adenovirus, like a deactivated a different kind of virus, and that gets into your system, and that causes you to produce that spike protein. So it's just different ways of getting you to produce that spike protein to mount that immune response. So that's the difference between them. In terms of the reason for the different waiting periods, it's really the way they tested it. So, one tested it 4 weeks apart. Moderna's 4 weeks between the first dose and the second dose, and Pfizer is 3 weeks between the first and second. But you can do it up to 6 weeks after, and actually, and the Johnson & Johnson is 1 dose, which is really a benefit.
That's good to know.
Yeah, and that's really why there's a lot of hope for the Johnson & Johnson, especially worldwide in places where it's less, people have harder time accessing immunizations because it's only 1 dose. So that's really going to save a lot of lives. It's very exciting.
And as of now, are they, I know the Johnson & Johnson one is not out yet. Are they known to be equally as effective?
So it's a little tricky to answer that question because they were tested at different times and they were tested for different things. So the Moderna and Pfizer were tested earlier before a lot of the variants were found. And so when they were tested, they were found to be 95% effective against disease, against getting sick. The Johnson & Johnson is still extremely effective, but it was tested, it's about 100% protective against severe disease and hospitalization. And that's really the goal. You want to be able to know that you're going to keep people out of the hospital and prevent death.
If they contract the virus, they'd be very minimally symptomatic.
Exactly. So it may not be preventing all illness, but it's definitely going to keep people out of the hospital and prevent death. And so that's really the goal. But Johnson & Johnson was tested a little bit later when there were more variants. So for example, in the United States, it was found to be about 72% effective against even mild illness, mild to moderate illness. But in other countries like South Africa, where there were more variants, it was maybe 66% effective. So because you had more variants and it was being tested when there were more variants circulating. So it's a little tricky to compare the two. It's not really fair. But it's still, it's still a very effective vaccine. And remember, the goal is to keep people out of the hospital and preventing death. Right. And so it's still a very effective vaccine, and it's only one dose. And there's newer data that's actually showing the longer you wait to evaluate how effective it is, the better it looks. So, the initial studies may have looked at it at a certain time after you gave the vaccine, but if you wait even longer, you'll see even stronger efficacy. So you'll see it may take a little bit longer to build up that immunity, but it's really even stronger. Yeah. So it's looking good. And I would definitely encourage people to get the vaccines because it's certainly better than getting COVID.
Yeah. I have a couple follow-up questions to that. So is that spike protein that you mentioned, is that sort of the same way in which having COVID antibodies works against the protection that you get from that?
Yes. So that's pretty much what the antibodies, at least the antibodies that we measure. Now, there may be other antibodies that we form against the virus, but the ones that we measure are generally against that spike protein. But remember, there are other parts of our immune system that protect us against that virus as well. Not just the antibodies, but we make T cells and B cells, which are other components of our immune system that also work against the virus. And they're a little harder to measure. The antibodies are easier to measure, and that's what we kind of use as a gauge. But
the additional protection.
Yeah, T cells and B cells probably last even longer and probably are stronger protection against this virus, but they're harder to measure. And so we may not even be aware of how strong our immune reaction might be, and how much we're protected actually that we are from either infection or the immunization, because we're not able to measure these things as well. Right. And B cells particularly have a long memory, so we may be more protected than we think.
That's good to know.
Yeah.
Related to that as well, I know that there's been some information coming out recently, very, very recently, that if you do have COVID antibodies, you may only need one dose of the vaccine. I don't know if you've heard about that. It's I think it's very, very new and not fully tested yet, but curious what you know about that or what you think about that.
I think there are a lot of people looking at a lot of ways to conserve doses of vaccine, and that would be one of them. And I think you can look at it in a lot of ways. Some people will be very strict in adhering to the original regimen that was tested because it was tested. Other people will want to see more hardcore data to support. So, what you mentioned, if you've had COVID and you get a vaccine, will you be as protected if you don't get that second dose? Right. There will be sticklers who really want to see the data. It kind of makes sense that you would have immunity if you've had the infection and then you get that. It would be kind of a booster in a way. Getting that vaccine would be kind of boosting your immune system. So it kind of makes sense that would be enough, but we don't have the data. So I wouldn't really be able to comment because I don't don't really know. I think we really would have to see data and long-term data to really make the assessment.
Right. Makes sense.
But at the same time, we do want to try to conserve doses so that we get more people vaccinated so we can get that herd immunity. So it's a balance.
Speaking of herd immunity, I'm curious sort of what the statistics are on New York City specifically, and just projecting into the future, like the Barnard Columbia community. Yeah, maybe if you want to define what herd immunity is first really quickly, and then sort of how close are we to that herd immunity, and when might that happen given the sort of current rate of vaccination in New York City?
So I don't know the exact numbers of where we are in New York City yet. I apologize, but I don't think, I mean, we're not there. We're not there yet. Herd immunity is basically when you have enough immunity in the community, in a particular community, that the virus basically has nowhere else to go. It's infected enough people, or there's enough immunity where the virus just can't find anyone else to infect, because so many people are either immune or have already been infected with the virus. Right. And that's when you reach about 80% of people who are either vaccinated or immune, that's about where you achieve herd immunity. We're definitely not there yet. You would think that we would be there after all New York City went through, but we're not there. We may be close, but we're not there yet. And so, I forget the second part of your question.
I'm sort of curious. I know sort of in recent weeks, the infection rate at least has dropped pretty significantly in New York, and I think in the country. It could be wrong about the country, but I know definitely in New York.
It is going down.
Yeah, I mean, I'm just curious to what extent that can be attributed to herd getting closer to herd immunity versus like precautions.
I think it's just we're not near herd immunity yet. Unfortunately, I don't think the vaccine rollout has not been efficient enough, and we really have to immunize a lot more people before we get even close to herd immunity, including children. And, children make up 25% of the United States population, and we have not even tested the vaccine in children yet. It hasn't even been tested.
By children, do you mean sort of what's the age cap on that?
So some of the vaccines have tested only 18 and over, and some have tested 16 and over. Okay. So it depends on which vaccine you're talking about. But
kids.
Yeah, but they're only now starting to test vaccines in children, and that's 25% of the population. So even if we have vaccinated every single person in this country over the age of 16 to 18, we still have not gotten 80% of the population. So we're a ways off, unfortunately.
Right. Yeah, that's true. I mean, I would think that also the sort of people who've already had it and have the antibodies would contribute to that too, but
to some degree, but we don't know enough. And it's been shown that there's definitely a higher immunity with the vaccine than with just infection with COVID. Right. So even if you've had COVID, you still should get the vaccine. Right. So let me just say that very clearly. We can't rely on just having been infected. Right. So we still encourage people to get the vaccine.
Sort of related to all of that, I know personally a couple people who've had the vaccine. I'm sure maybe you've had it. I'm sure you know people who've had it. I think there's some confusion around how you should act and how you should go about life once you've been vaccinated at this point in time, just because so many people have not been vaccinated. I guess, like, what are the COVID precautions that you should or should not continue to take after you've been fully vaccinated?
So that's a good question. So there is some very, very, very new emerging evidence that the vaccine may lower your chance of spreading the virus, but it's very preliminary and we can't rely on it. So right now, the recommendations are still to wear a mask, to socially distance, to take all the, wash your hands, to take all the precautions that we have been taking before you were vaccinated, um, um, uh, even after being vaccinated, particularly with others who have not been vaccinated.
Right.
If you're with someone else who's vaccinated, you may be able to relax that a little bit, but I would still err on the side of caution and, take the same precautions just to play it safe, because this is a scary virus and it's not worth taking chances.
Yeah. Great. Thank you. Let's see. I know we only have a few more minutes, so I'll just ask one or two more questions. But I think there's a little bit of confusion surrounding the level of immunity you have after your first dose. I know I've heard that, it's not helpful at all until you've gotten the second. I've heard that you're 50% safer after your first. So what is the data on that? Like the time period between your first and second dose, how how inoculated are you?
It's a good question. I think that, again, it's all very tricky, and it's also gray still. I've also seen data that have varied. I've seen everything from 50 to 75% immunization after the protection after the first dose. I think it may depend on which one. Moderna, I think, was shown to have 75% efficacy after the first dose. It probably also depends on how long after the first dose you're talking about, because it takes a while to develop the immunity. So it's got to be at least 2 weeks after.
Right.
I think the more time you wait after that first vaccine, the better. So really, again, it depends on how long after that first dose you're talking about. But it's certainly better to have 1 than 0. So 1 is better than none. And some people say even up to 80% efficacy, but I think it's probably around 75% efficacy after that first dose, particularly Moderna. The second dose boosted up to 94%. So, if you can get that second dose, it helps.
Right. Cool. Okay. I'm just going to ask one last question because I know you have to go. Thank you again so much.
My pleasure.
I think there is definitely some, not apprehension, but curiosity into the future about, I think for the first time, Barnard required a flu shot this year for enrollment, which I don't believe has ever been done in the past. And I know that, various people have different pre-existing ideas around vaccinations, different cultural reasons for or against it. So I'm just curious what your thoughts are on the likelihood of Barnard requiring this vaccine once, the country and the world sort of reaches that ability to distribute it on that level. Do you think Barnard would do that?
So I think I want to reiterate, I want to say, first of all, that this vaccine has been shown to be extraordinarily safe. The technology, particularly in the mRNA virus, that, we think of it as new, but it's actually been around for at least 10 years. And so it's extraordinarily safe. The reactions have been minimal. There have been no serious reactions. We've given it already to millions and millions of people, and there have been a handful of anaphylaxis, and no one has died from it, which is really quite impressive. It really, you really have to stand back and really take that in, because that's really enormous. And there haven't been really any severe reactions to it. There are almost no contraindications, meaning that there's almost no reason to not take the vaccine. So it's extraordinarily safe. The decision of whether it will be required for to be, to enroll at Barnard is going to really depend on what the state recommendations will be.
Right.
So we may not have a say in it. If it were up to me, I would recommend yes, required, because I think that's how we're going to get back to a normal life. And that's how we're going to achieve herd immunity. That's how we're going to get back to living the way we're used to living. But I think it's going to be, it's going to be up to the state and people above me who make that decision. But I think that's how we're going to get back to normal.
Great. Well, thank you so much for joining us. I know that you're extremely busy keeping us all safe and healthy right now. So thank you so much for not just for this, but for all the work you do at Barnard. Really appreciated by the community.
My pleasure.
Yeah, I'm Auden, a Barnard Health Ambassador this year. You can check us out on Instagram at BHA Barnard. And yeah, thank you, Marjorie.
My pleasure. Thanks. Take care.
Bye.